Good morning, everyone. I am Dr. Abhishek Hoshing, consultant ophthalmologist at Apollo Hospitals, Navi, Mumbai. And today, on the occasion of World Retina Day, we are going to briefly discuss about the various retinal diseases and conditions, the way to prevent and treat them, and also we'll be briefly discussing about the focus of this year's Retina Day, which is Retinitis Pigmentosa. So the retina is the light sensitive layer which is at the back of the eye. It is like a sensor or the film screen of a camera which gathers all the light information and converts it into electrical signals and then sends it to the brain for the brain to interpret. Like any other organ in the body, the retina can also get affected by various different conditions. They can be either congenital, which means you acquire them right from birth, or they can also be acquired, which means you either get them because of some infection or some sort of other systemic diseases which also affect other parts of your body. So in India, the most common retinal conditions which affect the retina are caused by diabetes, which is called diabetic retinopathy, and also by high blood pressure or hypertension, which is called hypertensive retinopathy. So in both diabetic and hypertensive retinopathy, the primary area of problem is the retinal blood vessels and the retinal capillaries, which are the fine blood vessels, which get affected, which can lead to swelling up of the retina, which can lead to formation of abnormal blood vessels, which can lead to blockage of some areas of the blood vessels, and all of this can lead to bleeding inside the eye, which can cause severe and significant visual damage, which in some conditions may be irreversible to a certain extent. Hence, it is extremely important that we all take adequate precautions to prevent the development of diabetic retinopathy and hypertensive retinopathy, and also to have an awareness to get appropriate timely examinations of our eye and treat the disease in its earliest stages wherever required. So people who have diabetes and high blood pressure should at least once in 6 months get their eyes tested by an ophthalmologist who will put an eye drop in the eye to dilate the eye, that is, make the pupil wide, and then do a detailed examination of the retina to see whether there is any diabetic retinopathy. From the patient's perspective, he or she should take extreme precautions to keep the diabetes and high blood pressure under complete check by taking appropriate medications, maintaining healthy diet and healthy lifestyle, and also try to keep the lipid level, that is the cholesterol levels in the blood, to a minimum so that the disease doesn't progress or in early stages doesn't develop at all. By doing this, we can ensure that the retina will stay healthy. So this is briefly about the diabetes and hypertensive retinopathy. There are other conditions of the retina which routinely affect our retinal detachments, which can happen due to any sort of injury. It can be a minor injury or it could be a major injury post accident. So it is extremely essential for everybody to have a detailed retina examination after injuries. People who are wearing glasses, especially high powered minus numbered glasses, do have a propensity of developing weak areas in the retina, which later on can break open and the retina can detach, leading to sudden and severe vision loss, which requires a surgical intervention. Hence, it is important to again prevent this condition from happening, and therefore people who have glasses should also get a regular retina checkup done after putting a dilating drop in the eye, and get it done from a trained ophthalmologist and not just at a optical shop near your house, because they probably will not do it appropriately. And by doing so, if we identify any areas of weakness on the retina, then these weaknesses can be strengthened by doing a small laser procedure known as barrage laser, and we can prevent the more severe outcome, which is a retinal detachment. It goes to without saying that the same is also applicable for children who have started wearing glasses, and even in them, the parents should take the children for a detailed retina examination to an ophthalmologist once every 6 months or at least once a year if so advised by the ophthalmologist, and so that the retinal health can be examined and treated. Now we'll focus on the focus of this year's topic, which is retinitis pigmentosa. Retinitis pigmentosa is a genetic and sometimes hereditary disorder which affects the retina. It is caused by damages to multiple genes in our body, and sometimes one gene is affected, sometimes two or more may be affected in the same individual, but it is an inherited condition. That is, the child is born with this condition, but the condition may start developing or start showing itself later in life. However, the parents may be able to notice some problems in the children's eyes, especially that the child is not able to uh, see things very clearly or has difficulty in seeing things in dim light or at night time. This is one of the important features by which retinitis pigmentosa can be identified, and therefore, if anybody has this sort of a suspicion about their child or any other member of the family, then a retina examination is definitely warranted. The retina examination is pretty simple. It is done usually again in the ophthalmologist's clinic by putting a dilating drop in the eye and doing a detailed retina examination. And sometimes the ophthalmologist may also advise electroretinogram, which is something like a ECG of an eye, you can call, which basically measures the functions of all the layers of the retina by analyzing the electrical signals generated from them. However, other conditions may also be associated with retinitis pigmentosa, like refractive error, which basically means that the person requires glasses, or sometimes there may also be cataract, which can be easily treated by doing a cataract surgery. Unfortunately, retinitis pigmentosa is a progressive condition, which means that in spite of all measures, the disease will keep on progressing gradually over time, and eventually it may lead to significant vision loss in all individuals, depending upon the time of onset and also depending upon the genetic variant. So it is essential that we take certain precautions and take certain other measures like low vision aids, which will help a person to carry out his or her routine activities without getting affected by the disease itself. Some of the other features of retinitis pigmentosa are lack of peripheral vision, which means that the extent of eyesight, that is from left to right, keeps on reducing, and ultimately the person starts seeing as if he or she is seeing only through a hollow pipe, which is known as a tunnel vision. Apart from this, there can also be extreme photosensitivity, which means difficulty in bright light in some of the individuals. Like I said, retinitis pigmentosa unfortunately does not have a proper treatment right now. However, efforts are being made to have a gene therapy developed so that this gene which prevents or cures the retinitis pigmentosa from developing can be injected into the patient's eye, and it is expected to cure the condition or at least improve the patient's condition. Currently, there is only one such medication which is available against a very specific RP65 gene, which can treat patients who have developed retinitis pigmentosa because they have a faulty RP65 gene. However, efforts are still on for development of cure based on other types of genes which can also affect retinitis pigmentosa. So briefly, retinitis pigmentosa is a progressive condition. It can cause night blindness in its early stages, and later on the field of vision or the extent of vision keeps decreasing. Uh, there is no definite cure as of now, but we can make a person functional, and we can help a person visually with appropriate glasses, some surgical procedures, and low vision aids, and the person can carry on his or her daily activities routinely without being dependent on others. So once again, on World Retina Day, I would encourage all of you, and I would also request all of you to take care of your health and also to take care of your retina. Have a detailed retina checkup at least once a year and follow your ophthalmologist advice regarding the cure and treatment of retinal conditions, if any, appropriately, so that you enjoy good eyesight throughout your life. Thank you.